Hello guys, so this is going to be the beginning of a medical series. This is going to be us discussing about some medical conditions and how they can be managed. So today we are going to be talking about PCOS. So let's get into it. PCOS is the short form of polycystic ovarian syndrome. PCOS is a hormonal condition that affects people with ovaries, especially in their reproductive years. PCOS can be termed as a miscommunication between the brain, the ovary, and general metabolism. In PCOS, we can encounter anovulation. Anovulation can also be called no ovulation at all. In PCOS, we can also see delayed ovulation or irregular ovulation. Also in PCOS, we can see high production of androgens, which are called male hormones. Also in PCOS, there are cysts in the ovary. You might ask, what is a cyst? A cyst is a tiny sac filled with fluid. Now remember I said that PCOS is a miscommunication between the brain, the ovary, and general metabolism. All right, let's talk about the brain. There is a gland called the pituitary gland in the brain. It is found at the base of the brain. This gland produces the LH, which is the luteinizing hormone, and the FSH, which is the follicle stimulating hormone. The job of the LH is to stimulate the thicker cells of the ovary to produce testosterone, while the function of the FSH is to help the eggs to mature and to prepare the ovary for ovulation. Now in PCOS, there is increased secretion of the LH, while there is decreased secretion of the FSH. So on testing or on lab, you're going to find increased amount of testosterone in someone that has PCOS. So in PCOS, there is a disruption of ovulation because there is going to be elevated testosterone due to the high secretion of LH, and there's going to be decreased secretion of FSH. So now let's talk about the androgens, which are the male hormones. In the kidney, on top of the kidney, there are glands called the adrenal glands. These glands release hormones called the DHEAS. DHEAS stands for dehydroepiandrosterone sulfate. Whenever this hormone is high, there is increased testosterone. And of course, we know how testosterone affects people that have PCOS. Also, high DHEAS will cause lots of acne. That is why you see people that have PCOS having acne. It's going to cause scalp hair thinning. So you're going to see people with PCOS having their scalp hair very thin. You're also going to have facial hair because remember, androgens are male hormones. So facial hair is mostly characterized by males. So high androgen is going to cause facial hair on women. And of course, there's going to be abdominal weight gain for people that have PCOS. The metabolic driver of PCOS is insulin. Insulin stimulates the ovary to make more testosterone. And it also reduces the binding protein called the SHBG. SHBG stands for sex hormone binding globulin, which increases the free hormone activity. That is why in PCOS, we always test for fasting glucose and we also check for fasting insulin. Now let's talk about the thyroid hormones. The thyroid hormones and prolactin are also evaluated because of the thyroid dysfunction. And also there is elevated prolactin that can mimic or worsen PCOS symptoms. Also, progesterone is a hormone that is made after ovulation. Now, if we say that in PCOS, there is going to be no ovulation or there is delayed ovulation, then it is wise to check for prolactin. Because if there is low prolactin, that indicates no ovulation. Alright, so progesterone is another marker for PCOS. Progesterone is a hormone that is made after ovulation. Now, you can remember when I said that in PCOS, there is going to be delayed ovulation or there is no ovulation at all. Now, if progesterone is made after ovulation and we check for progesterone and we find low amounts of progesterone, this is an indication that there can be a possibility of the person having PCOS. So whenever you check for progesterone and the levels are low, then you can think of PCOS as well. Let us speak about the general symptoms that you can find in somebody who has PCOS. The first symptom you're going to definitely find is irregular periods. Okay, there's going to be irregular periods, there's going to be missed periods. There's also something called hirsutism. Okay, that is excess facial hair. So when somebody has excess facial or body hair, we say that the person has hirsutism. Sorry about that. And hirsutism is a symptom of PCOS. We can also have weight gain, okay, or difficult losing weight in PCOS. Also in PCOS, there's going to be thinning of the scalp hair, okay, the hair on the scalp. All right. We can also find trouble getting pregnant, and this is one area where a lot of women come to the hospital for. All right. Now let's talk about the diagnosis. Diagnosis is strictly made clinically. Now, once somebody has those symptoms, of course, we have already started suspecting PCOS. Then you're going to do some blood tests. Now, this is a way to check for the hormone levels. Remember the hormones we mentioned, testosterone, prolactin, all these hormones. By the time we do the blood test and we check for these hormone levels, then we have an idea if the person has PCOS or not. Another thing is the ultrasound of the ovaries. Remember earlier I said that in PCOS you can find small cysts. Okay, then other things I mentioned about the ovary. So you can use ultrasound to determine if somebody has PCOS or not. Now let us talk about the management of PCOS. Mostly the management is based on symptoms, but we are going to be talking about lifestyle changes. That is your diet and also exercising. You need those to manage PCOS. Also, we'll talk about fertility treatment if pregnancy is desired. We also talk about birth control. Okay, so we have these birth control pills just for your periods. And also there is medication for hormonal imbalance and insulin resistance. So these are the ways you can manage your PCOS. When PCOS is not treated properly, the patient stands a high chance of getting type 2 diabetes. Also, the person also has a chance of having a heart disease and endometrial cancer. So, of course, patients with PCOS need proper treatment and management. So, generally, when someone has PCOS, it is better to treat the cause instead of treating the symptoms. Thank you very much, guys, for listening to me. You can tell me which other disease you want to hear about. Put it in the comment section and we'll talk about it. Thank you.